Today, let us talk about Guillain-Barre syndrome. The variants include number 1, the axonal variants, number 2, the demyelinating variants, and number 3, the GBS spectrum involves anti-ganglioside antibodies. Axonal variant is again subdivided into AMAN variant and AMSAN variant. AMAN stands for acute motor axonal neuropathy. AMSAN stands for acute motor sensory axonal neuropathy. In case of AMAN variant, there is a pure motor involvement without any sensory involvement. It is associated with Campylobacter jejuni infection, and there is a rapid recovery if there is no axonal degeneration. Coming to the acute motor sensory axonal neuropathy AMSAN variant, there is severe sensory motor involvement, sensory involvement, and autonomic dysfunction. Talking about the demyelinating variants, number 1 is classic sensory motor GBS, wherein patient presents to you with symmetrical ascending weakness, areflexia with variable sensory symptoms. More importantly, facial nerve is involved in 50% of the cases. Respiratory muscle involvement is seen and it usually reaches the nadir in 2 weeks. Next variant in demyelinating is pure motor, involving the motor weakness without sensory sign. Next variant is pure sensory, subacute or acute sensory involvement without any motor deficit. The next variant is paraparetic, involving the paraparesis of only legs. So we have got classic sensory, pure motor, and paraparetic variants depicted in the figure. Talking about the most important one, the anti-ganglioside antibodies variant or the GBS spectrum. In this, the number 1 subtype we have is Miller-Fisher variant, number 2 is Bickerstaff brainstem encephalitis, and number 3 is pharyngeal cervical brachial. In Miller-Fisher variant, the triad is ophthalmoplegia, ataxia, and areflexia. Sometimes it may be associated with isolated ataxia, where you call it acute ataxic neuropathy, or isolated ophthalmoplegia, where you call it acute ophthalmoplegia. More importantly, the antibody which is positive here is anti-GQ1B antibody. The next variant, which is commonly asked in exams, is the brainstem Bickerstaff encephalitis, which is nothing but includes the triad of Miller-Fisher variant, but the difference here is involvement of brainstem, pyramidal tract signs, and impaired consciousness. Here we find the antibodies anti-GQ1B. The pharyngeal cervical brachial involves weakness of the pharyngeal muscles, cervical muscles, and the brachial muscles without any lower limb involvement. The antibodies here include